So frozen shoulder, also known as adhesive capsulitis, is a strange condition because it's really common and yet we know very little about it. Very characteristically, it comes on out of the blue for no very good reason. Typically it affects people in their middle years, and for some reason seems to affect women more than men. There's no doubt that diabetics are more prone to getting frozen shoulder, and when they get frozen shoulder, the poor old diabetics get a worse version of frozen shoulder. But in the majority of my patients do not have diabetes, they just have bad luck. And this condition causes an inflammation of the lining of the shoulder, which is very painful. And very characteristically, the type of pain that people with frozen shoulder get is twofold. One is they get lots of pain in bed at night and struggle to find a comfortable place to settle. And secondly, they get pain when they're doing something that seems very minor or innocuous. It may be a sudden stretch out or reach. The dog takes off on the lead, or one of the kids pulls your arm, or you swat a fly, or you catch something instinctively that's going to fall off a desk, or stretch out hard under a desk to plug in into a socket. Those sudden, sharp, quick, unthought out movements are the ones that will absolutely cripple you, and you'll have this horrendous wave of pain running down your arm. And you just need to hold on and say, leave me alone, with tears in your eyes until the pain starts to settle. And it does, it settles very quickly, and within a couple of minutes you're back to yourself and back to normal. So that's the inflammatory component. The other aspect of frozen shoulder is a stiffness. That is, the bag or the capsule that contains the shoulder, which should be loose and capacious, becomes very thickened and contracted and causes a physical restriction to the amount of movement that you've got in your shoulder. And you will particularly notice that most commonly when reaching up behind your back. So girls often say they struggle to get their bra comfortably. Guys find that they can't get their wallet out of their back pocket. Oh, that may be an excuse in some people, but it's quite a common problem. Or an inability to properly lift the arm up. So frozen shoulder causes these two things, this very characteristic pattern of pain and this stiffness for no good reason. So in terms of how to manage your frozen shoulder, I would suggest you've got three main options. Option one is to live with a condition and wait for it to get better, because in everyone it does eventually. If you do not suffer with diabetes, then we can reliably predict that within a year or 18 months after the onset of your symptoms, the condition will have just disappeared naturally. We don't understand why that's the case, and at times it's really hard to imagine that your shoulder's ever going to recover. But it will, and it does, and it's reliable. So you may choose on reflection to say, well, as long as I know it's going to get better, I can manage my symptoms as they are, and I'll just carry on and put up with it. And that's a completely legitimate way of trying to manage it. The second option would be to have a cortisone injection. The cortisone injection has to be delivered in the right place. It has to go into the glenohumeral joint, not into the subacromial space where most injections for the shoulders are administered. Once it's put into the glenohumeral joint, within a week, most of your pain should and will have gone. The glenohumeral joint injection is great for relieving pain, so it dampens the inflammatory component of frozen shoulder, but it cannot and will not address the stiffness. So you will still be tight, you still won't be able to reach up your back, you still won't be able to reach up high, but at least it shouldn't hurt. And for some people, that's all they need. They just need to be relieved of the pain. They recognise that they can manage the stiffness, knowing too that that will get better naturally and in time. And the third option is surgery. Now, there are two varieties of surgeries, the arthroscopic capsular release, or there's the manipulation under anaesthetic. And the reasons why we choose each are tailored to the individual person. But if I talk specifically about the manipulation under anaesthetic, I will tell you this is done as day case surgery. So you're in and out on the same day. It's done under general anaesthetic, so you're asleep. And there's no cutting involved in this procedure. We simply have you off to sleep because otherwise it would be too painful. And while you're asleep, it's a gentle, controlled stretch of the shoulder to recover full movement. It's a controlled breaking down of the scar tissue that's restricting your motion. And at the end of the procedure, we give you an injection and then wake you up. So you're really only asleep for less than 5 minutes. So it's a very quick, very straightforward procedure with very low risks of complications. You'll be able to go home a bit later that day. You'll go home having already seen a physiotherapist and given a booklet of exercises. You'll need to commence physiotherapy within a day or two, but you'll need to commence your exercise program immediately, because the shoulder just wants to tighten straight back up again, and you have to be really diligent about doing your exercises in order to try and maintain your newly recovered movement. And after 3 weeks, in 90% of cases, the frozen shoulder just goes away and you are better, or almost completely better in 90% of cases. If you're in that unlucky 10%, the 1 in 10 for whom it hasn't been successful, it's a procedure that can be safely repeated and the success rate is the same. It's 90% successful.